Hello and welcome to Take Your Medicine. Today's show deals with a condition that affects many women across the world. Today we will be talking about endometriosis. So what is endometriosis? Endometriosis is a disorder in which tissue that normally lines the uterus grows outside of the uterus. This tissue can be found to start growing on the ovaries, fallopian tubes, or the intestines. Rarely can endometrial tissue spread beyond the pelvic organs. With endometriosis, the endometrial-like tissue acts as endometrial tissue would. It thickens, breaks down, and bleeds with each menstrual cycle. But because this tissue has no way to exit, it becomes trapped. When endometriosis involves the ovaries, cysts called endometriomas may form. The surrounding tissue can become very irritated, eventually developing scar tissue and adhesions that leads to abnormal bands of fibrous tissues that can cause pelvic tissues and organs to stick to each other. Endometriosis can cause pain, sometimes severe, especially during menstrual periods. Sometimes fertility problems may also develop. Fortunately, effective treatments are available. So to make it easier to understand, I want you to look at your hands. The palms of your hands has thicker, harder skin, since it's meant to handle all the work that we do. This can represent the uterine wall tissue. The back of your hands has skin that is much more thin. This is to aid in the movement of the fingers and hands. Think of this side of the hand as the ovaries and fallopian tubes. Now imagine if the thick side of the palm starts to grow on the back of your hand. Now you won't be able to move your fingers freely, and now it'll become more painful for movement as well. This is what happens with endometriosis. This is why it becomes so painful, because we have thick endometrial tissue growing in soft tissue areas. Common signs and symptoms include painful periods, pain with intercourse, pain with bowel movements or urination, excessive bleeding, infertility, and other signs you may experience include fatigue, diarrhea, constipation, bloating or nausea, especially during the menstrual period. Although the exact causes of endometriosis is not known, two of the leading factors that could be related are hormone imbalances and immune system disorders. I hope that you now have a better understanding to what endometriosis is and also the symptoms and what to look out for. Always check with your doctor if you suspect that you may have symptoms and book a checkup. If you liked today's show, please hit the like button and also subscribe to the channel. And also hit the notification bell to remind you of all upcoming episodes. Thank you guys for joining. Take care.